Syrian casualties, the Syrian people that are displaced, try to find refuge in the neighboring country of Jordan. And we see a fair number of the more severe casualties that have resulted from those hostilities. Munitions, blasts, artillery, mines, explosives. For the average MSF worker who comes here, sometimes they're very surprised, if not overwhelmed, by what explosive munitions can do to the body.
Light, please, light.
Light, yeah, Khadi. Light is there.
I don't know if I'm ever shocked so much as sometimes appalled by what munitions can do to the body and what our fellow man can do to each other. So it's sometimes more evoking a sense of pity and just disgust at how we treat each other sometimes. Certainly every injury is different, and we have to be prepared to deal with every possible contingency of injuries that occur on the battlefield. So never totally prepared for that, but we try to, part of being a surgeon is being able to adapt quickly and think on your feet and try to do the best we can for whatever the patient needs when they come in. As far as what's involved with the traumatic amputations, usually these are the results of either stepping on a mine or having an artillery piece explode near your feet, and it would typically just either totally demolish or mangle the lower extremity, anywhere from involving just the foot or up to the knee or even up to mid-thigh. They can bleed out very quickly from this and die if there's not very attentive battlefield care to stop the bleeding. They're often extremely dirty wounds, just embedded with shrapnel and a lot of debris from the battlefield, very infected, dead tissue. And so our job is to make sure the wound is clean, make sure it's appropriate level of bone and soft tissue so they can get a well-healed stump, and then eventually to try to get that wound to close so then they can make use of that lower extremity. I think initially many patients who suffer a traumatic amputation are, like any great loss, are in denial that this has occurred to them, and they don't want to think about what life is going to be like without their lower leg, for example. Once their wound is healed, then then we refer them for prosthetic devices, and we get them mentally prepared for dealing with this amputation. And most of them seem to adapt pretty well. Often these Syrian casualties are inspirational to us when we see everything that they've been through, the severity of the casualties, and yet they're so upbeat and optimistic and motivated to proceed forward with their recovery.